Currently, there are 9 FDA-approved medications to treat obesity. Additionally, there are several medications that, while not officially approved, are frequently used off-label for weight loss. We're going to cover all these medications, providing you with a comprehensive understanding of the various drugs currently being used for weight loss. Let's start with some weight loss medications approved for short-term use. When we say short-term, it means that the official guidelines recommend using these drugs for no more than 3 months. However, this doesn't imply that their effectiveness abruptly stops at the 3-month mark. In reality, many patients find these drugs beneficial for far longer. The primary reason for the recommended duration is more about safety concerns. Since there isn't enough data from longer-term studies, we can't be certain if using these drugs for extended periods of time might lead to serious issues later on. With that in mind, let's start with Phentermine. It was one of the first short-term weight loss medications approved by the FDA and is still in use today. Phentermine works by stimulating the sympathetic nervous system, leading to a significant decrease in appetite. People taking Phentermine can typically lose about 4.4% of their body weight compared to those taking a placebo. This means that using Phentermine adds an additional 4.4% weight loss on top of any weight loss achieved through other dietary or lifestyle changes. Like Phentermine, Diethylpropion also stimulates the sympathetic nervous system and is approved for short-term use in treating obesity. It works by influencing the actions of norepinephrine. Patients using Diethylpropion can expect to lose approximately 6.6% of their body weight. Now, let's move on to weight loss medications approved for long-term use, which means utilizing these drugs for a year or more. It's important to note that this doesn't guarantee continuous weight loss beyond a year, nor does it imply that they're more effective than short-term drugs. The key difference is that studies have demonstrated the safety of using these medications for an extended period and have shown some weight loss when taken for a year or longer. Let's start with Plenity. It's the first medication approved for overweight adults, whether or not they have other health issues, unlike other drugs that are typically recommended for those with a higher BMI or have specific health conditions like diabetes. Plenity is a hydrogel matrix that absorbs water to expand and fill about 1/4 of the average stomach volume. This promotes a feeling of fullness, similar to how soluble fibers work for weight loss. Since it operates mechanically and not chemically, Plenity is considered a device rather than a drug, making it safer for a broader range of overweight individuals. However, compared to other obesity medications, Plenity tends to be less effective, showing only a modest 2% body weight loss. Orlistat aids weight loss by inhibiting lipases, reducing the absorption of fat from the gastrointestinal tract. The maximum recommended dose of Orlistat can cut fat absorption by about 30%. Notably, Orlistat is available over the counter without a prescription in the United States under the brand name Ali. A key consideration is that it works best when paired with a low-fat diet, and not following this diet may lead to the medication's ineffectiveness or very messy side effects. Users of Orlistat can anticipate an extra 3.8% body weight loss when combined with a low-fat diet. Contrave is a combination tablet containing bupropion and naltrexone. Bupropion is a reuptake inhibitor affecting dopamine and norepinephrine. Naltrexone, an opioid receptor antagonist, enhances the effects of bupropion by reducing inhibitory feedback loops. This combination results in reduced cravings, food intake, and body weight. Contrave is particularly effective for patients dealing with emotional eating and food addiction. However, it does have significant effects on the brain, leading to potential side effects like anxiety and mood changes. Nonetheless, those who respond well to Contrave can anticipate a 4.8% body weight loss when used in suitable patients. Saxenda, which is the drug liraglutide, is also under the brand name Victoza for diabetes. This medication activates the glucagon-like peptide 1 or GLP-1 receptor, which helps in reducing food intake, curbing hunger, and slowing digestion. Administered through a daily injection, Saxenda has positive effects on blood sugar levels in diabetics, as well as improvements in blood pressure and lipid levels. Users of Saxenda can anticipate a 5.4% body weight loss. Qsymia is a controlled-release tablet that combines phentermine and topiramate. Phentermine stimulates the sympathetic nervous system, decreasing food intake and potentially increasing energy expenditure. Topiramate, approved for epilepsy and migraine prophylaxis, aids in weight loss through promoting taste aversion by making food taste bland and reducing food intake that way. Qsymia combines the two and effectively reduces appetite and binge eating. It is considered safer for long-term use compared to phentermine alone, while being just as, if not more effective for weight loss. Users of Qsymia can expect an 8.6% body weight loss. Wegovy, which is the drug semaglutide, is also under the brand name Ozempic for diabetes. Similar to Saxenda, but considered stronger and longer lasting, semaglutide is administered through weekly injections. It works by suppressing food intake, reducing hunger, and slowing digestion. Wegovy marked a new generation of weight loss medications that were highly effective while being somewhat safer to take. For example, rather than potentially causing cardiovascular problems, individuals on Wegovy have shown cardiovascular benefits. Patients using Wegovy can anticipate a 12.4% body weight loss. Zepbound, which is the drug tirzepatide, is also under the brand name Mounjaro for diabetes. This dual receptor activator targets both GLP-1 and another receptor called GIP, resulting in a more potent suppression of food intake, reduced hunger, and slowed digestion, with potentially fewer side effects. Administered through weekly injections, Zepbound is currently one of the most effective weight loss medications to date, although this may change soon with the introduction of retatrutide. Users can expect a 15.4% body weight loss. Now, let's discuss some medications that are commonly used off-label for weight loss. When we say off-label, it means that healthcare providers prescribe a medication not specifically approved by the FDA as a weight loss drug. These medications might have originally been developed and approved for other purposes, but their side effects or other actions may hint at potential benefits for weight management. Clinicians often consider these medications on a case-by-case basis to support weight loss. However, due to their off-label use, there's typically less research investigating their effectiveness or safety for weight loss. The evidence may be less clear-cut or more challenging to interpret, making it harder to determine their true effectiveness compared to approved medications. Additionally, off-label medications are generally less potent for weight loss and may be trickier to use correctly. They might also lead to more severe side effects and may not be as safe for long-term use. Therefore, seeking guidance from a doctor is a must. Starting with Bupropion, initially designed for depression and smoking cessation, it has a side effect of causing weight loss. While the weight loss observed with Bupropion is modest, it stands out as a preferred alternative to many antidepressants that often lead to weight gain. When used off-label for weight loss, Bupropion is typically administered in sustained-release formulations at doses of 400 milligrams and results in an average weight loss of around 2.8% body weight. Metformin is an anti-diabetic drug that lowers glucose production and enhances insulin sensitivity. This not only reduces blood sugar levels, but also contributes to a small amount of weight loss. Studies on patients with diabetes consistently show approximately 2 to 3% weight loss beyond a placebo, with more significant weight loss in those with higher insulin resistance. Pramlintide is an injection approved for diabetes treatment. Pramlintide mimics the action of the hormone amylin, which helps to regulate blood sugar levels. Its impact on weight loss is believed to be mediated through brain receptors that improve appetite control. Treatment with Pramlintide resulted in a placebo-corrected reduction in body weight of about 3.7%. Sodium glucose transporter 2, or SGLT2 inhibitors, is yet another class of medications primarily used for diabetes. These drugs promote glucose removal through urine, leading to lower blood sugar levels. 4 SGLT2 inhibitors are approved in the US: canagliflozin, dapagliflozin, ertugliflozin, and empagliflozin. They have shown around a 2 to 3% body weight loss in studies involving adults with type 2 diabetes. Topiramate is originally an anti-epileptic drug also approved for migraine prevention. It is found to reduce body weight in various disorders. Randomized controlled trials demonstrate that topiramate is both tolerable and effective, resulting in patients losing around 2 to 3% of their body weight. Lastly, Zonisamide, another anti-epileptic medication, has shown in randomized control studies to promote modest weight loss, ranging from 2 to just over 3% body weight loss in patients with obesity. The weight loss drugs available today are just a glimpse of what's on the horizon. The past few years have brought more advancements to the drug weight loss industry than we've seen in decades. If you're curious about upcoming and new weight loss medications, take a look at my detailed review in the description below. Hi, I'm Dr. Brian Young. What are some of your experiences using these weight loss medications? Let me know in the comments down below. Subscribe and hit the notification bell to stay up to date. And if you found this video informative, please leave me a like and share this video with someone you know can use the info.